Good day. I am Dr. ROJoson, Director of ROJoson Pep Talk. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. There are 3 courses in the Pep Talk. I completed the core course on October 9, 2021. From October 23, 2021 onwards, I have been tackling health disorder and health issue courses. This may take 3 years or longer. My pep talk today is entitled Low Value Operation Circumcision. This is part of the health issue course. The empowerment objective is for the lay people to have an understanding of the issues of circumcision as a low value operation. The contents of this pep talk will be the following. What is a circumcision? What are the different types of circumcision? What is low value medical care? Low value operation? Why is male circumcision considered as a low value operation? And what are the tips in avoiding or reducing circumcision as low value or unnecessary operations? What is circumcision? What are the different types? First of all, strictly speaking, there are 2 types of circumcision based on the sexual organs, male and female circumcisions. Male circumcisions are far more frequently done than female circumcisions. For this pep talk, I will focus on male circumcisions. However, allow me to give you first a brief idea on female circumcisions. Female circumcisions are also known as female genital cutting or female genital mutilation as recommended by the World Health Organization. The prevalence is that it affects over 200 million women worldwide in 30 countries, with an additional 3 million women and children at risk annually, based on the WHO 2018 report. The female circumcisions consists of a procedure that intentionally alters or causes injury to the female genital organs for non-medical reasons. So it's carried out from as early as infancy until the age 15, although in some areas it is delayed until just prior to marriage. There are 4 types of circumcisions or female circumcisions described by the WHO. Type 1 involves excision of the prepuce with or without excision of the clitoris. Type 2 involves partial removal or total removal of the clitoris and the labia minora. Okay. Type 3, called infibulation, includes removing part of the external genitalia and approximation of the remnant labia majora. So this can result in small opening or introitus and the creation of a covering seal over the urethra and or vaginal opening. Type 4 includes all other harmful procedures to the genitalia like scratching, pricking, and others not specified in the first 3 types. There are several complications associated with the female circumcisions or female genital mutilations. You have the acute complications, which consists of hemorrhages or bleeding, pain, septic shock, genital edema, infection, abscesses, urinary retention, broken bones, and death. Whereas the chronic ones or chronic complications consist of urinary tract infections, vaginal infections, difficult labor delivery, dyspareunia, and decreased sexual satisfaction. The female genital mutilations is a cultural practice performed predominantly in Africa, the Middle East, and in Asia. So many in the Western world today consider FGM to be a human rights violation, and there have been international efforts to eliminate this practice. Personally, I don't know if female circumcision is being practiced in the Philippines. I hope not. If being done, it is a low-value operation. It's causing harms with no medical benefit, unnecessary costs, waste limited healthcare resources. Now let's go to male circumcisions. So the Tagalog or Filipino term for this is tule or tule, okay, frequently done in the Philippines, frequently done for cultural and religious reasons more than medical reasons. For the Muslim and Jews, it's mainly religious reason. For the Christians, since St. Paul already said circumcision is not needed for salvation, it's more for cultural reason and peer pressure. There are several types of male circumcision. But male circumcision is essentially a surgical procedure to cut or remove partially or totally the foreskin or the prepuce of the penis. So in this diagram, it shows just a dorsal slit, just a cut on the simple cut on the prepuce, just to make the opening bigger. Here, there's an excision, either partial or total of the prepuce. And then here is an excision in the newborn using a special instrument called gomco. There are other types of instruments available now. What is a low-value medical care and low-value operation? Low-value medical care is defined as a medical care or services that provide little or no benefit to patients, have potential to cause harm, incur unnecessary costs to patients, or waste limited healthcare resources. When I say no or little benefit, this is in terms of effectiveness. Thus, it is not effective with regards to the goal of the medical service to be rendered. Potential to cause harm, this is in terms of risk for unwanted side effects or adverse effects, complications, and even death with the medical service rendered. Unnecessary costs to patients is in terms of money spent by patients and families for the medical services rendered, which is considered not necessary. And wasted limited healthcare resources is in terms of unnecessary usage of a finite government funding budget for the health of the citizens like the PhilHealth, and unnecessary usage of finite number of services like hospital beds, tests, and procedures. Low-value medical care can be equated to unnecessary or not needed medical care rendered to patients primarily because of no or little benefit and with potential to cause harm. It's also equated to being not indicated and not in the patient's best interest when weighed against other available options, including watchful waiting and other more conservative measures. In contrast to low-value medical care, a high-value medical care is providing the best medical care possible, efficiently using resources and achieving optimal results for its patients. What are the different types of low-value medical care? So you have unnecessary medications, unnecessary diagnostic tests, and unnecessary operations or surgeries. When you talk about low-value medical care for unnecessary surgeries or operations, so these are performance of the operations or surgeries that provide little or no benefit to patients, may be harmful, incur unnecessary costs, and waste healthcare resources. Examples of low-value operations will be circumcision, cholecystectomy for asymptomatic gallbladder stones, and cholecystectomy for gallbladder polyps. Why is male circumcision considered as a low-value operation? The use of circumcision for medical or health reasons is an issue that continues to be debated up to now. The American Academy of Pediatrics found that the health benefits of newborn male circumcisions outweigh the risk, but the benefits are not great enough to recommend universal newborn circumcision. Thus, the conclusion is that it should not be routine. It should be done as indicated when there is phimosis, meaning the foreskin is too tight to be pulled back over the head or glans of the penis. Another indication is paraphimosis, the inability to return to the foreskin to its original location. And lastly, recurrent urinary tract infection due to a foreskin problem. The cited circumcision benefits are the following: less risk for urinary tract infection, but this is not totally true. A reduced risk for sexually transmitted disease in men, again, not totally true. Protection against penile cancer and a lower risk of cervical cancer in female sex partners. This is very rare. Prevention of balanitis, inflammation of the glands, and balanopostis, inflammation of the glands and foreskin. Again, this is very rare. So in reality, these cited circumcision benefits are uncommon and can be prevented with non-circumcision measures like hygienic practices and safe sex. For the circumcision risk, you have the following. Pain is the most common, and it certainly is there. The risk for bleeding, infection at the site of the circumcision, which is also common. Irritation of the glands, higher chance of myositis or inflammation of the opening of the penis, and risk of injury to the penis and even death. So this shows a patient writing in pain, crying in pain during the circumcision. Another one, not as exaggerated as the first one. Those routinely done for cultural reasons and for peer pressure are low-value operations or circumcisions because they provide no or little benefit, cause harms, incur unnecessary costs, and waste limited healthcare resources. There are three factors when you talk about causes of low-value operations. Three factors: physician-driven factors, patient or consumer-driven factors, and tertiary factor, health system factors. The physicians are the primary factor because they encourage and promote circumcision despite knowing it is driven more by cultural reason and fear of peer pressure than medical reasons. Also, they stand to earn financially. Some of the physician-driven factors are the following: mindset in the medical management of the physicians. You have such kind of ritualistic and maximalist physicians. Financial gain, whether incentivized or non-incentivized. Ways to please patients or consumers, their mindsets and desires over rationalization of care. No clear presentation and discussion of options of management. There are three types of physicians based on their approach to medical problem solving, decision making, and recommendations. So these are their mindsets: ritualist physicians, maximalist physicians, and minimalist physicians. Ritualist physicians are those who make medical management decisions based on habits and not mainly on critical analysis. This can contribute to low-value medical care. Maximalist physicians are those who institute medical management that includes a lot of things that are not essential and needed by the patient. Nice to have. This can also lead to low-value medical care. Minimalist physicians are those who institute medical management that includes only those which are essential and needed by the patient. So these are the people who will contribute to high-value medical care. Financial gain, whether incentivized or non-incentivized. For the incentivized one, so there is a system in the healthcare institutions which incentivize the physicians with rewards such as stock dividends, perks, free trip abroad, etc. For the non-incentivized one, so there's enrichment by the physicians on a personal basis, such as from revenues from personally owned pharmacy or diagnostic businesses. And then they would prefer more revenues with operations rather than giving prescriptions which are not the income is not as big as doing operations. So there's more of a business sense rather than a compassionate sense. Pleasing patients on their mindsets and desires rather than explaining, educating, and convincing them on the rationale or rationalization of care. No presentation and discussion of BRCA data and processes in the selection of the cost-effective options. Okay. BRCA stands for Benefit Risk Cost Availability. Note, high-value medical care looks for the most cost-effective options, not just the most effective options. I repeat, they look for the cost-effective options. That's why the cost would have to be factored in. So this is a table showing the BRCA analysis or comparison, presentation of data. On the first column are the options of the procedures and operations. Second column, benefit. Third column, risk. Fourth column, cost. Then last one, availability. The second patients are the secondary factor, okay, because of their mindset and desires, okay, which physicians want to satisfy above anything else and which usually lead to low-value medical care. Again, there are three types of patients, just like the doctors: ritualist patients, maximalist, and minimalist patients. Ritualist patients are those who make medical management decisions based on habits, fads, and not mainly on critical analysis, which can lead to low-value medical care. Maximalists, those who desire medical management that includes a lot of things that are not essential or needed. So nice to have. Again, this would lead to low-value medical care. And then for the minimalist patients, so these are patients who desire medical management that includes only which are essential or needed by the patient. This will lead to high-value medical care. The third factor will be the health system factors. Okay. Here, there is facilitation, allowance, and no policing, no quality control of practices of the physicians, and there are inadequate public health education, patient-centered care management program, or patient empowerment program. So what are the types of low-value circumcisions based on the nature of the operation or the justifications? It's not needed because just watchful waiting or medications will do. The circumcisions which are not proven effective is another type of low-value circumcision. And then it's unsafe circumcision. Unsafe circumcision is another type. And then if it's done, it's costlier than other equivalently effective treatment. So it's not cost effective. All operations, surgeries have side effects, both expected and potential. After the expected side effects, surgeons will try to control all the risks for potential side effects or complications of the operations like bleeding, infections, dehiscence, even death, etc. However, no surgeons will guarantee against their occurrence. Those routinely done for cultural reasons and for peer pressure are considered low-value circumcisions because they provide no or little benefit, cause harm, incur unnecessary costs, and waste limited healthcare resources. The last topic is what are the tips on avoiding or reducing circumcision as a low-value or unnecessary operations. Okay. As I said, there are three factors on the causes: physician, patient, and health system factors. So the question is, how do you control this? So we've seen a lot of this advertisement in the media. Okay, circumcision to the packages, promoting circumcision. Another one with different packages, 2,000 versus 4,000. 4,000 being done in the operating room by experienced surgeon, 2,000 being done in the emergency room by resident doctors, physicians. Different packages, 2,500, 3,500, 4,500, 3,000, 5,000. And then also advertisement on Operation Today, or the free one. Okay, free Operation Today, showing a row of boys being circumcised all at the same time. So the question is, what can you do as a layperson to control these factors? So I suppose you can help in the advocacy against unnecessary routine male circumcision, especially those done for cultural reasons and for fear of peer pressure. Try to break the vicious cycle of peer pressure-driven circumcisions for the sake of your grandson and sons and grandsons, because in the future they will be victims of these low-value circumcisions. Inform and educate the other people of low-value unnecessary routines male circumcision. This is another help in the advocacy. Be empowered as a patient. Advocate patient empowerment. Okay. This is the least that you can do, okay, for your own sake as well as for your relatives' sake. Be always in touch with reliable medical information on low-value and high-value medical care. Knowledge is power. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, kapangyarihan, to gain greater control over decisions and the medical management of oneself in promoting high-value medical care and avoiding low-value medical care. So a strategy will be to be constantly aware and vigilant against potential for low-value performance of operations by surgeons, by physicians. Always aim and insist for high-value operations from them. Another strategy is to be proactive in controlling and avoiding low-value operations. So make the physicians aware that you know the processes on how to reduce low-value and how to promote high-value operations. Have a shared collaboration with them in accomplishing this. Before accepting the recommendation for an operation for your relatives, ask the physician, what is the diagnosis? What is the indication for the circumcision? What is the goal? And what are the options? The options should include no circumcision. And then what are the comparative data information on the various options in terms of benefit, risk, cost, availability parameters? And then what is his recommendation on the cost-effective options? Always use the RCA process in selecting the cost-effective options or treatment. This should include watchful waiting and more conservative measures like medications or as options. When the physician asks for your response to his recommendation, feel free to ask as many questions that you may have on the data and information presented, and also ask him to temper or validate your personal biases, mindset, and desires in favor of an objective decision making. You are free and have a right to seek a second opinion if you want. However, when you do this, follow the same processes mentioned above, especially the BRCA process. Some more recommendations. Patients who do not know whether there are ulterior motives behind the physician's recommendations for operations, such as incentivization and personal business sense. The best diplomatic strategy is to prevent these ulterior motives is to ask the physicians to present and discuss the comparative data and information on the benefit, risk, cost, availability of the different options of treatment. Then analyze them and then make a judgment on the physician's competency and whether there is a hidden ulterior motives. The best physician attitude will be those who will speak like this, who will think like this. I'm sorry, your perceptions on a particular options of treatment for these medical conditions are myth, incorrect, and unfounded. I have to correct you through this explanation. I cannot just satisfy your mindset and desires and have the operations done. Okay. I'm sorry, we have to decide on what type of treatment options to take based on hard evidences and not just based on fad and popular practices. My personal practice, I don't do routine male circumcisions only when indicated, such as phimosis, paraphimosis, and recurrent urinary tract infection, secondary to a foreskin problem. I don't subscribe to routine neonatal circumcision. I use the BRCA to advise and to make recommendations as objectively as possible and honestly and compassionately. I respect patients' mindsets and desires, but I enlighten them if they have misconceptions. If parents are insistent on having their sons of minor age circumcised just because of cultural reason and fear of peer pressure, after failure to convince them of the non-necessity, I would politely beg off, meaning I will not do the circumcision. So summary and takeaway, I have tackled all these topics: circumcision, types of circumcision, low-value medical care, low-value operation, why is male circumcision considered as a low-value operation, what are the tips on avoiding and or reducing circumcision as a low-value unnecessary operations. Again, to summarize, those routinely done for cultural reasons and for fear of peer pressure are considered low-value circumcisions because they provide no or little benefit, no, they can cause harm, they can incur unnecessary costs, and then they can waste limited healthcare resources. We want to avoid this. Okay. So there's no such thing as painless circumcision. Be always in touch with reliable medical information in low value and high value medical care. This is a takeaway in relation to patient empowerment. Knowledge is power. It gives power. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions in the medical management of oneself in promoting high-value medical care and avoiding low-value medical care. So with this, I end my pep talk. I hope I have empowered you to have a better understanding of the issue of circumcision as a low-value operations. Thank you and good day.